You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. Today we're going to be talking about the disease lupus. Lupus is a very confusing type of disorder. Many people have heard of it, and they may even have family members or friends who suffer with it, but it's very hard to actually explain it to someone else. And so that's why I thought today would be a good opportunity for us to go over lupus, as well as some of the different types and some of the treatments that are currently available. Now, lupus is considered an autoimmune disease. Autoimmune means that the body attacks itself. And so there are antibodies which are created, and the body basically considers certain normal functions to be abnormal, and that causes some major issues. People who have lupus oftentimes have problems with different joints, different organs, and different systems in their body, but it doesn't happen all at once. They'll have good days, and they'll have bad days. They'll have relapses, then they'll have remissions. And the symptoms can vary from very mild to extremely severe. So again, lupus is not one specific infection. It's not one specific type of problem. It's a group of disorders that comes with autoimmune symptoms, meaning the body is attacking itself, and then the body tries to heal itself, but incompletely. Now, there are different symptoms that people will have at different times. Some of the more common ones include severe fatigue, and this can occur in over 80%. Some people estimate 100% of patients, and it's very, very disabling. So this is not something where you wake up on a Monday and feel kind of tired because you don't want to go to work. This is extreme fatigue, where people can't get dressed. People are not able to eat. They're not able to care for themselves, and it almost looks like depression. These people have very difficult time sleeping, and they also have other comorbidities, including things like fibromyalgia, which is generalized joint pain. That's very hard to pinpoint in one specific area of the body. About half the people with lupus will also have a fever, and this is not due to an infection. It's not an infectious or bacterial or viral cause. This is from the inflammation. Because the body is attacking itself, it creates chemical markers and it creates a fever where the body temperature will rise. This fever does not respond typically to anti-inflammatories, Tylenol, Motrin, things like that. It actually requires other stronger medications, including steroids, to actually calm it down and allow the fever to come back to a normal temperature. Then there's things like myalgias. Myalgias are the medical term for muscle weakness or other types of muscle pain, where it's severe, it's generalized, it's not localized just to one region of the body. And then there are severe weight changes. So many people who have lupus flare-ups, they'll have weight loss because, as I said, they can't eat. They're not able to consume regular foods. Their appetite is severely diminished, and they even have side effects with the medications that they're trying to take to help them during the fever and the other symptoms that they're having. Now, about 90% of people will have trouble with their joints. So either their muscles, bones, ligaments, things like that. And it won't quite make sense, meaning those people haven't been doing heavy lifting. They haven't been going to the gym. They don't have a job that requires extensive lifting or repetitive motions, but their joints are extremely painful. And then this can progress. It can actually involve the skin. And people will develop a rash on their face or other parts of their body. We call it a butterfly rash or a malar rash. These people will have a rash that looks like a mask. It occurs on the cheekbones of the face and sometimes goes over the nose, but it usually spares the lips. And this is most common after people are out in the sun. So it's almost like they've tanned, but they haven't, because the distribution is very, very unusual. It actually looks like butterfly wings. So these people are considered photosensitive. So people who have lupus, again, just to summarize, they have autoimmune disorder. The antibodies are attacking itself, including the skin, the joints, the muscle, and the internal organs. Now, the episodes that we talked about with flares, during a flare, the symptoms are horrible, and those people oftentimes come to the emergency room where I may see them, or their family doctors will treat them, and they oftentimes have to be on very high doses of medication to calm down the pain, the swelling, and some of the other symptoms that they're having. It's actually very common for people to be hospitalized for several days to get them through that flare-up, and then they may be started on medications that are similar to chemotherapy drugs. Oftentimes, people with lupus have to see a specialist called a rheumatologist. A rheumatologist is a doctor who manages different types of disorders, including arthritis, rheumatoid disease, gout, things like that. But lupus, as an autoimmune disorder, requires the care of a specialist. Lupus is not curable. The medications do help, but it doesn't reverse all of the problems that occur. And so it's very important for people to be connected with the right resources, and that can hopefully prevent some of the complications long term. Now, there are many people that are celebrities who actually have lupus. Some of them have been very open in talking about it. Others have been more private, but they clearly have some symptoms that match up with lupus. One of the more famous examples is Selena Gomez. Selena Gomez is a very known Disney star actress. She's also a very well-known singer. She developed lupus at a very young age, and it caused severe flare-ups, eventually causing kidney failure. And a few years ago, Selena Gomez actually had a kidney transplant. She had a match from one of her best friends, and that allowed her to actually live and not be hospitalized. She was able to continue touring. She was able to continue with her life, and for the rest of her life, she will be on anti-rejection medications to help with her kidney recipient as a transplant, but hopefully her lupus issues will not flare up as badly as they did before. Now, other people who also have lupus include Toni Braxton. She was diagnosed in 2008 during a concert when she collapsed in Las Vegas, and she also had a possible heart attack, but her blood testing confirmed that it was actually lupus that was acting in a very unusual way. And she's been treated, but she's had frequent relapses since then. And other people who've actually had lupus include Seal. Seal is another singer who's very well known. He's talked openly about his issues, and he's been very vocal about ways that it's actually affected him. He's had trouble dealing with the chronic pain and the suffering that he had to go through, but you can see that he's an adult male. He's very active. He makes music and travels, but you can see that people who have lupus can be functional. It's just that when they have flare-ups, it interferes with their life. Now, we talked about a little bit earlier some of the medications that are available. So typically with lupus, the treatments are going to be to focus on the organs that are already affected, including the heart, the kidneys, the liver, and so on. And then the medication is designed to help prevent those relapses and to reduce the progression. So many of these medications include steroids, things like prednisone. There's also people who are on other types of methotrexate or chemotherapy medications, and their blood testing has to be monitored very, very closely. These people, if they do get sick, even with their chemotherapy treatments, oftentimes they're going to be hospitalized, and then they can develop an infection, which may result in death, unfortunately. So people who have lupus need to be very, very closely monitored. If you have a family member, a friend, coworker who has lupus, you'll know that they'll have very good days, and then they'll have periods of very, very bad days. And so it's best to respect their privacy, but also offer assistance when they need it. Be sure that they are taking their medications, and then be sure that they're following up with their doctors. And hopefully that can allow them to be more managed and more comfortable. But if things are not working out, oftentimes this is a cause of disability. And those people may have to leave the workforce. They may have difficulty raising a family. And some of them will be hospitalized and ultimately may die as a result of lupus. So I'll have some links on our blog if you'd like to get more information about lupus. There are many resources available. There's patient advocacy groups out there as well. They are working towards a cure, but it's not there yet. So if you'd like to get some more information and send your comments to us on social media, I'll be happy to post them. And I hope that you learned a little bit about lupus today. We'll see you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&Out Radio Network. Be sure to connect with Dr. Amron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.